And welcome back to WFMY News 2. The coronavirus continues to be a problem that affects all of our lives. It has been weeks since this pandemic started, but now it is not the time to give up. Dr. Bruce Swords is the Chief Physician Executive with Cone Health, and he joins us here today for our 2-year well-being to focus on the importance of social distancing and flatten the curve, terms that we have heard many times over the last 4 weeks. Dr. Swords, it is good to see you again.
Good to be here. Thank you.
So explain to us what flattening the curve means and why it is important to do that during this pandemic.
So many of your viewers have probably already seen this idea of a curve. And so if you think of a graph where there's a peak on the graph, the idea is to flatten the curve, make the curve smaller, and while doing that, the curve also extends. So what that really does is allow communities to manage the number of people who will get, in this case, coronavirus over a longer period of time. So there isn't an acute need that can't be managed, but rather there's a subacute need or a moderate need that can be managed over a longer period of time.
So it's about not exhausting those resources, right, once it starts to flatten.
That's right. So there's resources in the communities, there's resources within our healthcare system that can't be used all at once, and it's easier to use those resources over a longer period of time.
So when that curve does start to flatten and we start to see it really level off here, it's still not the time to stop social distancing and to let our guard down. Why is that important? Why are we hearing that message from officials?
You're exactly right. Is when the curve starts to decrease, what that means is there are fewer people being diagnosed or hospitalized with coronavirus, but there is still ongoing transmission. So if all of a sudden when we hit the top of the curve or even on the downhill side of the slope or the curve, transmission still happening. So if the door's open, we can give it to each other again, and we'd see a rise in the curve very quickly after that.
Interesting. So just because that line is flat does not mean that it still cannot be transmitted. A lot of people are asking, what's the best way? What can communities do to flatten that curve?
Well, I think you've already said it, and we've heard it a lot over the past month, and that is to stay away from each other. So the concept is avoid, not just avoid, don't be in large groups, period. Don't be around people other than your family, folks that you live in your own house with some caveats to that. So going to the grocery store, going to a necessary physician office, there are some things that we have to do. And even in those situations, we should be socially distant, stay away from each other, at least 6 feet.
Some good insight, Dr. Swords, and a lot of things that, we are learning as you're giving us these answers. So we are going to post a link to this interview on our website, WFMY News 2. You can watch it again. You can share it with your friends if you learned something from this. But Dr. Swords is going to stick around until 6 o'clock this evening, and we want to hear from you. You can get your coronavirus questions answered. Just text them right now to 336-379-5775. We will spend the rest of the half hour working to get you those answers. Again, text your questions to 336-379-5775. We're back in 3 minutes.